The work of our Climate Change and Health Working Group, I believe, is critically important because up to now, climate change and health did not form a salient part of the curriculum for FETPs. And over the last few decades, increasingly, we've seen the effect of climate change events. And you have to bear in mind that FETPs are trained not only to respond to outbreaks and pandemics, but also to other public health emergencies, such as natural disasters and humanitarian crises. And clearly, climate change often triggers or is a factor involved in causing these other public health emergencies that actually are in the workspace of FETP residents. I mean, an example I could possibly give is that Cyclone Idai in Mozambique. FETP residents of Mozambique, FETP, were critically involved in the response to that cyclone in its aftermath.
It's because there is a need to integrate the climate information in the way the FETP programs work at the local level. And why is this important? Because this information could improve the way that we can develop our surveillance. For example, we can develop an early warning system using the forecast of climate variables like precipitation or temperature, but with other climate variables that we can relate it with social variables or with economic variables. So developing this early warning system, basically what we could do is to address in a better way the outbreak investigation that we are doing right now. And the early warning system is just basically a tool that can help us to improve the decision-making process in the public health sector. And especially in Latin America, I think it's important to do this, and I think for the rest of the regions, but at least in the region that I'm from, I think we are seeing a high incidence, for example, of diseases in different parts of our region, for example, dengue or Zika or chikungunya or malaria. Right now, the vectors are disseminating because the climate is changing, the temperature, the precipitation, the humidity are changing, and they are allowed that these vectors basically go and adapt to different environments and create the habitat basically to develop this disease in different areas. So I think it's important to use this information that can allow to understand where are like the new places where we could have these diseases that we have.
This work is so important because many countries, many societies and communities have already experienced the effect of climate change and environmental change in general. There's been not just extreme events such as heat waves and floods and droughts and hurricanes, but also the slow trend that changes the climate, the circumstances where disease can arise. This is so important. Although the first impacts on societies are those extreme events, the general understanding of what's going on is something really important to capture and understand better. And if I compare my awareness of environmental epidemiology as normally practiced in academic research institutions, which tends to want to have very large data sets based on routine data, national, international level, and it's been very valuable and important work. I have missed the fact that there is some willingness and capacity to capture information from the field, and I think that's where the specific skills and capacity of field epidemiologists come in.
So climate change really now is of global concern. Heat waves, extreme weather events that keep becoming more intense, climate-induced disease outbreak, poor air quality, and so on. All those events really impact the health of populations. And the impact of climate change on health is being studied, and many institutions and organizations in the field of public and global health are working together to lessen the burden of climate change on populations' health. And with climate change threatening people's health in almost every country, it really has become essential for frontline public health workers to have, I would say, the necessary knowledge to identify, but also to respond to those climate-related threats. And I believe it's also crucial to put into place strong surveillance systems and also to develop communication strategies to raise awareness of the public, but also of policymakers.
And this is a really important counterbalance to the existing capacity in environmental epidemiology, which is a little bit sometimes overly reliant on method development and maths, and in fact ignoring some of the real change on the ground that I think field epidemiologists would be able to contribute so much to, especially if guided by the working group. So I really look forward to seeing the various projects emerging from that.